Hey guys, Nurse Alyssa here. I'm going to try something a little bit different for the next few videos to see how it goes. I'll be playing these videos live, and then at the end, I'll take time to answer questions or comments that you may have. So if anything comes up while you're watching, be sure to leave it in the comments, and I'll make sure to address it at the end. So let's get started. Arterial ulcers are not just a wound, they're a sign of compromised blood flow. Missing the early signs can lead to tissue death, infection, and even amputation. In this video, we'll cover how to recognize arterial ulcers, key red flags that require urgent referral, treatment, and what nurses and patients must know to keep these wounds safe. Arterial ulcers result from arterial insufficiency, meaning oxygenated blood can't adequately reach the tissues. The most common underlying cause is peripheral arterial disease, where arteries become narrowed or blocked, not allowing blood to flow properly. Without sufficient blood flow, tissue becomes ischemic. Ischemic describes a condition where a body part lacks significant blood flow, leading to oxygen and nutrient shortage. Healing is impaired. Even minor trauma can progress to ulceration. Major risk factors include diabetes, smoking, hypertension, hyperlipidemia, advanced age, coronary or cerebral vascular disease, and chronic kidney disease. Patients often have multiple risk factors at the same time, significantly increasing the risk. Arterial ulcers have distinct features that can help differentiate them from venous or pressure-related wounds. Common locations are distal toes, tips of toes, lateral foot, and heel. Appearance, typically deep with a punched out look. The wound base is pale, gray, or yellow with minimal or no granulation tissue. The wound is typically dry or has minimal drainage, and it also has well-defined wound edges. Pain is often severe and it's worse at rest or at night due to leg elevations. Patient may report relief when they dangle their legs over the bed as gravity helps moves the flow of blood. You will find that the leg is cool to touch, has shiny, thin, hairless skin with a delayed capillary refill, weak or absent pulses, and the toenails may be thick or brittle. These systematic signs are just as important as the wound itself. Treatment starts with blood flow. Treatment of arterial ulcers begin with one critical principle. Arterial ulcers will not heal without adequate blood flow. Local wound care alone is not enough for these types of wounds. The primary goal is to identify and correct the underlying cause of the vascular insufficiency through timely referral and intervention, vascular assessment, and medical management. Patients with suspected arterial ulcers require vascular assessment, which may include ankle brachial index, toe pressure, Doppler, or vascular imaging. Medical and vascular management may involve optimization of antiplatelet or anticoagulant therapy, cholesterol and blood pressure control, to stop smoking, glycemic control, or even surgical revascularization if indicated. These interventions address the root cause of the wound. If we don't correct the cause, the wound will not heal. Local wound care principles. While blood flow is being assessed or restored, local wound care focuses on protection and prevention, not aggressive closure. Key principles include protect the wound from trauma and pressure, maintaining a clean wound environment, managing moisture appropriately, avoiding maceration as this can cause further tissue breakdown, using non-adherent or protective dressings. The goal is to stabilize the wound, not force healing. Now, I do want to address debridement. So debridement must be approached very carefully. Do not aggressively debride dry, stable eschar in arterial ulcers without vascular clearance. That eschar is the body's natural protection in an ischemic environment. Debridement decisions should always be guided by vascular status and the input of their vascular surgeon. What to avoid in arterial ulcer treatment? There are several important don'ts in arterial ulcer care. Don't apply compression therapy, no heating pads or direct heat to the limb, no tight dressings, and no constrictive footwear. These actions can worsen blood flow and tissue damage. Supporting patients. Supportive care plays a critical role and includes optimizing nutrition and hydration. I do have my wound healing cookbook available on Amazon. The link's in the description that will help you ensure you're getting the nutrition needs to optimize your body to support healing. Encouraging patients to quit smoking if they do, manage pain appropriately, educating patients on foot protection and daily inspection, prompt reporting of any changes in pain, color, or temperature. Education and early action are key to preventing complications. Successful treatment requires early recognition, prompt vascular referral, protective wound care, and interdisciplinary collaboration. Red flags and when to escalate. Arterial ulcers are high-risk wounds. Immediate escalation is required if you observe a rapid wound deterioration or expansion, black eschar or gangrene, signs of infection, severe ischemic pain unrelieved by repositioning, and sudden changes to the color in the foot or toes. Any arterial ulcer that is not improving requires urgent vascular assessment. These types of wounds rarely heal without restoring blood flow. Arterial ulcers are a medical warning sign, not just a skin issue. Early recognition, assessment, and urgent referral can prevent limb loss and save lives. Sorry, I forgot to put on my mic there. Sorry, guys. So I'll just restart here. This is my first live, so sorry about the complication there. I didn't add my mic in. But I'm going to start with the questions that have already been submitted. There is 12 questions. If you guys have any questions as you're just jumping in here, feel free to add them in below. Anything that's related to the topic that we're discussing today, so arterial ulcers. So the first question is, can arterial ulcers become dangerous? So absolutely, they can become dangerous. They can become infected. They can become gangrenous. We can have tissue death, and this can all lead to amputation. When we don't have blood flowing to our lower limbs properly, any slight infection, anything can make the wounds worse a lot quicker than a normal wound that does have blood flow. So absolutely, they can become very dangerous very quickly, and amputations can happen. Next, we have, should arterial ulcers be kept moist or dry? So if we have dry, black, stable eschar, this should honestly be left. It's your body's way of protecting the wound. So a lot of times we'll just paint these with povidone iodine or betadine and then just keep a dry cover dressing over top of them to make sure that they're protected. Now, if the wound is open and slightly moist, we just want to keep that slight moist environment. So eyeball moist is all that we need. It's kind of better to keep them closer to the drier side. So just make sure eyeball moist. Because any aggressive treatment or moisture, it can cause more tissue damage. Next question, is compression safe for arterial ulcers? So generally, no. We don't want to be using any compression on arterial ulcers, as this does cause reduced blood flow and can cause more harm. As we get less and less blood flow, it's going to cause more harm, even amputation. Now, some people do have mixed etiology wounds where it's venous and arterial issues going on. So sometimes we can apply a really light compression if it's that mixed etiology. But we got to make sure that we're doing that ABI testing, making sure that the legs can support it. Can arterial ulcers heal without surgery? So in some cases, we can get some improvement and healing if we're making sure that the patient isn't smoking. If a patient smokes, this really reduces blood flow even more. It causes vasoconstriction, and it does for quite a few hours after you even smoke. So the blood flow is even worse. So we want to make sure that we're not smoking. We have blood sugar control. We're controlling our blood pressure and cholesterol. And there's also some medications to improve blood flow. But we really need to make sure that we have the blood flow. That's what's going to heal these wounds. But once again, without any vascular intervention, these things can help. What type of wound dressings are avoided with arterial ulcers? So anything that aggressively debrides the wound, we don't want to be using that. We don't want to be using occlusive dressings because they do tend to trap moisture, and the wound can get too moist, creating an environment where the tissue will start breaking down. We don't want to be using any tight wraps or compressions. And we don't want to be using any adhesive dressings that can cause damage to the fragile skin. What dressings are commonly used for arterial ulcers? Okay, so the dressings that we normally do use, it really depends on blood flow and wound status. So dry protective dressings, especially if you have that dry, stable eschar. Non-adherent contact layers, light antimicrobial dressings if there is risk for infection or if there is an infection, and protective paddings. This helps reduce friction and pressure. How often should arterial ulcer dressings be changed? Okay, so we want to keep the wound clean. Okay, so anytime that dressing gets dirty, wet, saturated, we want to be changing it out. But we do change arterial ulcer dressings less frequently than other wounds because too many changes can cause disruption to the fragile tissue. It can increase pain and reduce protection. Okay, we want to prevent infection in these wounds. It's super, super important because they can get really bad really quickly. And then we don't have the ability to heal as well as if a normal wound will heal with proper blood flow. So we don't want aggressive treatment here. We just want protection and stability. What can I do to prevent arterial ulcers from getting worse? Okay, so don't smoke. Keep the feet warm and protected. You want to avoid tight shoes or pressure. You want to manage diabetes, heart disease. Inspect your feet daily, your feet and legs daily. And you want to be noting any increase in pain, color changes. Sometimes we get satellite lesions on the wound or around the wound. We want to make sure any changes that you notice, you want to be contacting your healthcare provider right away, because once again, things can get bad in these wounds quickly. So we want to be catching things and having assessments. If you notice anything out of the ordinary, it's better to get assessed and get it checked out right away to prevent complications. Can nutrition help an arterial ulcer heal? So yes, nutrition, it does play a critical role, but it doesn't replace blood flow. Okay, so proper nutrition, it supports the ability of your body to repair once you have adequate circulation. Okay, you obviously want to optimize your body while you're waiting for the blood to be properly fixed. So through either revascularization, however your doctor is managing it, it's important that we are eating properly, because the blood flow that we are getting to our limbs, we want it optimized. So it's super, super important that we are eating properly. So our protein, our vitamin C, our zinc, our iron, our healthy omega-3 fats. We want to make sure our body's optimized so it is getting the most nutrition possible to heal that wound, especially while we're waiting for proper care and to fix the blood flow. Why is blood sugar control so important? So high blood pressure, it does damage blood vessels, and it also slows down the healing process. So for patients with diabetes, we want to make sure that they have a stable glucose level, and this will help the wound heal properly, because once again, high blood sugars in the body will not allow the wound to heal properly. Okay, what nutrition mistakes can delay healing? Okay, so once again, if you're not eating enough protein, if you're skipping meals, if you have poor hydration, it's super important that we are drinking enough fluids throughout the day. One, to replace any fluids that we are missing from, like, that are leaking from our wound. And we need to optimize our body. If we have hydration, it will help blood flow also. Eating high or ultra processed diets, this isn't nutrition. So we really need to focus on foods that provide nutrition. For the little bits of nutrition that is getting to the wounds, we want it to be optimized. Okay, and for the last question here, what is the most important thing to remember when healing an arterial ulcer? So dressings protect the wound, nutrition optimizes the body's ability to heal, but only blood flow will actually allow the wound to heal. Okay, so we want to make sure to always remember when it comes to arterial ulcers, it's blood flow. So optimizing blood flow to the limb will allow the wound to heal. So a lot of times this does involve seeing a vascular surgeon and having revascularization surgery. Okay, but that's all that I have here. That's all the questions that I have for today. I hope you did like this. I do plan on doing a few more of these lives. If you guys like them, then I will keep doing them on Wednesdays, and I will be putting out under the community post today where you can put any questions for our next video. The next video is going to be on different dressings to control moisture levels in a wound. So keep an eye out for that community post, and you can post any questions, comments, concerns underneath that video. But that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now.